And let's return to Kumasi, to that press conference which is underway. The Regional Director of Health is addressing the media.
Good morning. On behalf of the Regional Health Administration, I would like to thank all of you for coming. We've gone through some few updates. Now we are looking at the way forward after the lockdown. As the President said, all the protocols and guidelines we've given since the outbreak of COVID-19 still holds. In fact, the lockdown was just a measure to strengthen the protocols and then the guidelines. None of the protocols and the guidelines have been discarded at all. So we have to make sure that we observe all the rules and regulations. What we are going to do right now is to strengthen surveillance. And as part of strengthening surveillance, we've come out with certain key activities or strategies that we are going to embark on. Ashanti region and Greater Accra has been classified as a high burden region. In fact, the whole country has been zoned. We have 4 zones. Ashanti and Greater Accra belong to zone 1, that is high burden. Then depending on the number of cases that you get, up to those regions without cases, they are the low burden. So for the high burden regions, we are going to enhance surveillance. And as part of the enhancement of the surveillance, we are going to do active contact tracing to isolate, test, and then follow up all the positive cases. So anybody who is identified as a positive case will be isolated. And following the isolation, we have what we call mandatory quarantine and then self-isolation at home. We will have to, the medical team is going to assess the home environment. If the home environment is not good enough and will promote infection, then we will move into what we call mandatory quarantine, where we've been able to secure facilities for this mandatory quarantine. They will first be tested, and then we'll follow them up for 14 days. After 14 days, they will be tested again. Those who will be negative will be discharged. Those who are positive will be followed up to see whether they are going to exhibit any signs and symptoms. That is for the contacts. We also have what we call the mass screening. Under the mass screening, we have certain hotspots in the region. The hotspots are areas where we've isolated cases. And then all the households around where we've isolated cases will go into what we call voluntary testing. All of them will be tested, but this one is voluntary. And then those who are positive will be enrolled, as we said, and then followed up. We are also considering testing high-risk groups. The high-risk groups are the frontline workers, drivers, taxi drivers, Uber drivers, market women, and those who are selling the market. These are the people who usually come into contact with a lot of people. And then they will also be enrolled into what we call the voluntary testing. So they will first be, it's voluntary, but they will be tested, and then those who are positive will be enrolled. And then the routine surveillance will continue. Under the routine surveillance, if you have any signs and symptoms, fever, cough, difficulty in breathing, what you need to do is that you call the number 112. You don't have to come to the hospital. We will come to where you live, and then the medical team will interact with you, and then if it's necessary, we will do the testing, and then we'll follow you up. For the cases, we've categorized them into asymptomatic, mild, moderate, severe, and critical. For those who are asymptomatic, they are the most difficult ones to deal with because they don't have any signs and symptoms, yet they are positive. And these are the people who can easily transmit the infection to you because they themselves don't know that they are sick. And unfortunately for us, this constitutes between 70 to 80% of all the cases that we've identified so far. That's the reason why we are saying that despite the fact that the lockdown is not there, if you don't adhere by the rules and then the regulations, you don't know the person that you are coming into contact with. So as you sit in the car, as you go to the market, you may meet some of these asymptomatic carriers, and if you are not wearing your mask and you are not observing the social distancing, then it's likelihood that when you come into some of these people, they can transmit the infection to you. So we will all have to assume that any person that we are coming into contact with and we are not observing the rules and the regulations, it's likely to give us what? The infection. So we'll have to be very, very serious on this. The next is those who are presenting with the mild symptoms. They are also very few. We have a facility in Kumasi South. We've been able to expand it from 8 bed to 20 bed now. So those who are mild, those with mild symptoms, and those with mild to moderate symptoms will be admitted at the treatment center at the Kumasi South Hospital. Those with severe, critical, and then moderate to severe symptoms will be admitted to Kofanochi Teaching Hospital and will be managed. All of them will be given the opportunity, and then after 14 days, we will review them, they will be tested, and then those who are positive will be followed up again. Those who are negative will be discharged. So that's the procedure that we are going to follow from here. The most important is that the rules and regulations still applies. The lockdown, we all admitted, was difficult, especially for the poor and then the vulnerable. So it's out of very good wisdom that the president decided that he's going to unlock the lockdown. But as he said, that is not the reason why we should assume that the fight is over. The fight is not over at all. This is the time that we need to strengthen the fight and then make sure that we all adhere by the rules and the regulations. And when we do that, it's likely that we may contain the infection. So number one is that social distancing is the key. And anytime you come closer to any person, less than 2 meters, then you know that you are in trouble. So if you don't have anything to do at all, please make sure that you stay at home. Because anytime you step out of your house, then it means that you are exposing yourself to what? To risk. The proportion of asymptomatic carriers are many. And it's not likely that you will identify them because they themselves don't know that they are sick because they are not showing any signs and symptoms. The wearing of face masks is so important because, as we all know, the disease is spread by droplet infection. So anytime you wear face mask, it protects you better because it's likely that at least you will be better protected than not wearing face mask at all. We have several types of face masks. Even handkerchief that is appropriately made is a face mask. You cannot wear it. You don't need to put a lot of burden on what we are already using in the hospitals. But if you can also manufacture your own face mask, I think it will be appropriate. But make sure that anytime you are stepping out of your home, you should put on face mask to protect you. A lot of countries have done that, and they've come out with a lot of success stories. I believe that we also have to adhere to this. So the social distancing, the wearing of face masks, and adhering by all the rules and regulations, hand washing, using sanitizers and other things is the key. I believe that even without the lockdown, if we adhere by all these rules, then the principle is about the same and nothing will happen, and we will all help to fight COVID-19. We would like to thank you for coming. Wish you God blessings. Thank you.
And so that's the Regional Health Director, Dr. Emmanuel Tinkran, telling us what the region is doing. We know that 5 have tested positive out of 204. Essentially, he's saying that surveillance will be strengthened and people who have to go into mandatory quarantine as well as self-isolation will be made to do so with strict supervision.